Well, the basic diagnosis tests before considering IVF are, in our opinion, first, a general blood test to confirm that you are healthy, including hemogram, coagulation test, and all the biochemical studies that are usually requested. Then a complete hormone profile, specifically including the anti-Mullerian hormone. This is the hormone that is going to help us first confirm that it's worth trying an IVF with our own eggs, and second is going to help us decide which is the protocol that we are going to use. The lower the AMH is, the stronger the protocol should be. Okay, and in order to, because we know that those ovaries are not going to produce too many eggs. It is also important to have a scan done just to confirm that there's nothing wrong with the uterus, because if there's anything wrong, it should be fixed before we start the stimulation, like could be polyps, fibroids, cysts, or ovarian cyst. And of course, we also need a spermogram, and sometimes more than one. If the spermogram is okay, if the first one is normal, and there are no other risk factors on the male side, well, that's fine. We don't need to repeat it. In cases in which there is an abnormal spermogram, we usually recommend repeating it at least once, just to confirm that that was not an exceptional circumstance, because there is sometimes a huge variability in the quality of the spermogram, and then we proceed with the second one. So to sum up, hormones, general blood test, including hormones, specifically AMH, to decide the protocol and to confirm that it's worth starting the IVF, and then a scan and a spermogram. That's the basic setup. In some other cases in which there are something in the medical history that suggests that it could be other problem, like having sexually transmitted diseases or things like that, it could make sense to carry out another test, just focus on these risk factors. But the basic setup is the one I've mentioned before.